This conference will now be recorded.
I want to know if it's that one that's working or if it's coming off of this.
Because when you're seeing it, it's high compared to mine.
Boop, boop.
That's
Okay.
the one.
All right, let's see. Yes.
Hello. Oh. Yeah, it's. I don't know, but it's not talking. Yeah, it worked pretty good.
1 second, one more test.
Hello.
Yeah.
This conference will now be recorded.
That's really good. Who called and said was it Ashley? They called? Yeah, she called. Markers.
Oh, they're over there goofing it out right now.
Environmental.
I would really like to stop it from you. We're trying to get another guy.
Oh my God.
Okay. How do y'all feel about that test?
Good.
That was good.
Yeah.
So you can put a dressing on your neck.
Huh?
Neck to navel occlusive dressing.
Oh. Neck to navel is occlusive. So the theory behind that is they don't want outside air getting in, right? And so because we have so many structures here, like your arteries, your like jugulars, that you don't want that outside air getting into the jugular and causing an air embolus.
And aren't like the nerves like specialty in your neck too?
Yeah, there's
Like-
a lot of
If they get air into them, then they'll burst.
I'm not sure so much if like air will get into the nerves. I'm not sure. I'd have to look that up.
But isn't it a nerve issue too? Not just like if there's a laceration, but like if somebody.
Yeah, because you have like your thyroid sits right here, so all that has vasculature to it, but then there are like nerves that run down. And then like your spine, like all of this in your neck is just.
Until this class, I thought your
Sensitive.
thyroid was like in your belly.
You're like, oh, my thyroid.
Well, like thyroid gland. Come on, dude. It's like somewhere in there, dude. Well, now, no.
Y'all seen the pituitary gland? It looks like a nutsack
Yeah.
in your brain. My favorite gland. Okay, any other questions about the tests? So I seen one that was like missed a lot was the spinal injury one. What happens during a spinal injury?
That blow up one, that explosion, is that one?
No, it said something like, I just.
Signs of shock?
The shock following.
Yeah, the shock following the spinal injury.
Isn't that when like the body experiences paralysis, or is that wrong?
So it could be paralysis, but think everything. So like all our veins and arteries and nerves from that point down are just like,
Oh, they dilate?
yeah, everything dilates.
I
Yeah,
think that's what.
I did the.
What question number is that?
30, oh no.
Mine was 15, but it's which of the following describes shock following spinal injury?
Okay, yeah. Yeah, it was the,
Dilation of the blood vessels resulting in reduction of perfusion
Yep.
to tissues.
yeah, so that's like, whenever we were talking about like those dermatomes and like from one point down, like their skin will even change color. Like,
Yeah, I second guessed myself on that
See,
one.
don't second guess yourself. That's
You
what happens.
know how hard it is to do that and break yourself again?
Yes, yes.
I read the question 9 times.
I'm intimately familiar with
I'm
second guessing.
pro-
Yeah, I read it 9 times. So I was trying to make it this time.
Yeah. Yep, so our Cushing's triad, what's our Cushing's triad?
Low heart rate, high blood pressure. I don't know the third one.
Jake? You just ran this scenario.
I know.
What is it?
Low heart rate, high blood pressure.
Down.
Breathing?
Regular.
Shane Stokes respirations.
Good.
There we go.
Yeah, and remember, like, so the pattern for Shane Stokes respiration is irregular. In real life, if you have a patient that's doing, if they're doing Shane Stokes respirations, like the chances of you recognizing it is pretty off. Yeah.
Sorry.
Yes.
One of these questions, it says, which of the following is a transport decision? And I picked deciding on how long to spend on it. That's a transport decision.
Yeah, but in a trauma, you always want to limit your on-scene time to less than 10 minutes, so the
Exactly.
I think
So
your transport
that's
decision is
exactly what
like
that is.
where you're taking them.
where you're
Yeah,
going.
so where you're gonna go, so like, are you gonna go to the level 1?
But that's what you're deciding with that.
Your on-scene time should be minimal no matter what. Isn't it? This is trash. This is planet bullshit.
That one I just screwed
Use
up.
that one from now on.
What?
Another one I seen that was missed a lot was the, if there's an object impaled in the head.
Oh, yes.
Bulky dressing.
Rigid, bulky dress.
Not the
Oh, I think I got that one right.
Now, if it's specifically in the eye, you
Hold
cover
on.
both eyes.
Hold on, I'm looking for it. I don't know what number it is, but
Me neither.
I don't agree with some of these.
GSC scale.
I'm gonna
CR.
write a letter.
I am gonna write a
yes,
letter.
I got that one right.
So last year, there was one of the questions that popped up on a pretest, and it was like about shocking somebody if they were touching metal. And it said that you couldn't shock somebody with the AED if they were touching metal. I wrote a letter. I was like, this is wrong. I wrote a whole email to them and was like, this is incorrect because of our biphasic systems that we use in this century. And they ended up removing the whole question. They were like, thank you for your input. That question has now been removed. Yeah.
When I was talking about the motorcycle patient though, or whatever,
Which one?
this one, it
This
doesn't
one?
say if he is unconscious. he
Oh,
says he's
yeah.
fine.
Oh, yeah, it
So why
doesn't
would I
say
give him
that he
chest
doesn't have a
compressions if
pulse,
it-
which is why I didn't put begin chest compression, or why I put that was
With
inappropriate.
one patient involved, what on-scene intervention is inappropriate for this patient?
Oh.
It is extensively splinting the patient's injuries. If he needs chest compression, you're gonna do that. That's appropriate. If he needs suction, you're gonna do that. If you're manually stabilized, you're gonna do that. But you're never gonna extensively splint. Like, I've had patients that like literally every arm, like both their arms and the leg is broken. I'm not just gonna start splinting, right?
They'll go to the ER looking like Jesus.
I put
just
manually
crucified.
stabilized it. Oh, that's bad.
Now, if you have like a 45
Oh,
minute
that's bad.
transport time and you got the hands and the time and the resources to splint everything, sure. Am I gonna go and be like, well, this one finger's broken, and the arm's broken, and then this finger's broken, and then this toe's broken, and then this leg's broken, like, that's extensively.
You just have a crap ton of sand. It's got
Yes.
actually everywhere.
Don't
Fucking
let me
bubble
lose
wrap,
time.
I missed the stupid question.
GCS scale.
I missed that one. Yeah.
Oh, I screwed up.
I missed
with that.
one of them.
I missed the cervical. So I was trying to count two. I was like, finger in my neck.
Isn't it five?
He's all filling his
Isn't
head.
it five?
Seven.
It is seven.
Seven.
I picked five.
Remember breakfast at seven?
I don't
said-
remember any of that. I can't remember saying. That's my only problem.
That's how I remembered it, was breakfast at seven.
Same.
I thought it was breakfast for five.
Dinner at 5.
Oh,
Dinner at 5.
wrong.
Any other questions about this?
Oh,
Um,
and then tacos before bed or something like that.
Four tacos.
Or four tacos.
5 tacos before bed.
I feel like
So 5, 6, or more.
Unresponsive patient.
dude, I'm always one off on that stupid fucking coma scale shit.
yeah, I thought pushing away was a 4.
I thought it was a six
Was it
because
not?
that's your good. Like that's a good reaction.
Well,
I thought it was
you're
3.
able to localize. No, because see, I thought
Hold on.
the 3 was the pulling away.
The,
Because this is localizing, right? And then pulling away is like retracting
oh,
from,
5.
which is
I
lower.
put
So you
3.
can have-
I thought this was
Yeah,
4.
Push that push away.
That's a six.
No.
It's a Glasgow scale.
He's off.
Finger butt.
I know. I was one off, dude. Just like the last time we did. I was one
If
off
I
every
tell
time.
you, give me a thumbs up if you do this,
Every time I think
that's a
of
six.
Following orders. Or
Just verbal
commands.
commands, but if I can physically push you away from me,
You're at that point
Yeah, so
localizing.
confusion, think like bruise.
That doesn't mean that you're following
And then
commands,
even
because
though
I
they
can walk
might
up to somebody that's inebriated, extremely inebriated, give them the whole freaking 5-finger death punch to the chest, right? And they can be like, wham, right? But then I look at that same person and be like, hey man, can you freaking give me a thumbs up? And they'd be like,
potato. Hell yeah.
So that'd be a 1 then if you do that? Or that'd be a 4?
what, if you can follow commands?
Yeah.
It's a 6.
Still 6.
I know.
Yeah, that's where I messed
We need
up
to work
too.
on that.
That's that, was that the?
I even tried studying that thing. And I was like,
Yeah, so remember, your highest number is your best quality, is your, like you're doing everything right. Your low number
Oh, is one
means
that
you're
kind of fucking.
dead, DRT.
A rock has a GCS of 3.
This paper right here, what's this GCS?
3.
3. Me?
You're a 6 right now.
Well,
I have
I'm pretty close to 6.
My baseline's a 14.
Yeah.
Maybe a 13.
Baseline's a 14 at most.
Yeah.
Okay. Okay, environmental emergencies. So we're going to learn.
There's 46 slides.
46.
Yeah, dang.
There was a long chapter.
It's a big long chapter, but it covers a lot.
Yeah.
A lot of stuff.
I mean, if she cut it in half compared to what's on the computer, we're good.
How many is on the 88? Oh, yeah, we're good.
It's because she took all those extra ones and combined them all.
Yeah,
Yeah.
yeah. Because there's some stuff on there, you're just like, you just repeated that like 5 slides ago.
Yeah, and they like tell you, the thing I don't like about the built PowerPoints that they already have is like, they tell you an ailment, and then they're like, here's your treatment, but the treatment's literally the same thing for all of these ailments that they're treating, so there's like extra slides where it's like, make sure that you take appropriate precautions and secure the airway and do this. You guys already know all that. You know how to run scenarios. I'm not gonna sit here and be like, this is how you treat this every single time, play by play. So, all right, so learn signs and symptoms of heat and cold emergencies and how to treat them. They're pretty cut and dry, right? If someone's cold, warm them up. If someone's hot, cool them down. Yeah, it's crazy how that works. But you want to be careful about how fast you do that. So learn specifics of water-related accidents and altitude sickness. So even out here, somebody being from sea level, just coming out here and trying to like go on this big old hike up Lamoille, and then they end up Lamoille Summit at 10,000 feet.
I am
Like they can still have signs of altitude sickness if they came from like sea level. So these are things that around here we kind of have to think about some. especially like down in Austin and that Lamoille, that kind of area. And then treatment for bites and stings. All right, so if someone is exposed to cold, the exposure might not be the only danger. So think of like, who in here has gotten absolutely sloshed and like hung out in the cold before and you didn't even feel it? You're out there in like a tank top and shorts.
Yeah, it feels good.
Right? Like a sweater on the
Especially
inside.
after drinking a bunch of whiskey.
Just stupid.
Yeah. So these are things that we have to think about is like young people. Also think of like homeless people that have other comorbidities going on. We don't really have homeless people that hang out here and call 911 for this kind of stuff. Occasionally. But that's one thing you also want to think about is there's people exposed to this. So we want to be careful.
I didn't see a frozen dead person until I got here.
Oh, really?
That's like not a real big issue in Georgia. Like you'll get hypothermic patients, but they'll drop down to like 30 on a bad night. But like I didn't see a truly frozen dead person until I got here.
We had a guy
A little creepy.
where I used to live. He would always pass out in the ditch drunk or like lay down on the old school steps and stuff like that. One day we got a call, yeah, he passed. He'd been out there a while.
Yeah.
It's,
Yeah.
a little creepy.
Frozen.
And I feel like the frozen people that freeze to death, there's always like that period of like where they go a little bit crazy right before they die, and they like think that they're overheating, so like
They
they'll
strip
strip
naked.
their clothes off. Okay, so a couple different ways about how our body loses heat. So radiation, right? So it's just radiating off of you. Like you can like put your hand over what you feel and it's a little warm, or your body and it's a little bit warm. Sometimes like if you ever have like an injury, like a knee injury, and your knee swells up and you can like not even touch it, but you can feel the heat, radiation, right? So evaporation, that comes with like moisture. So one good way that we like to cool people down if they're way too hot is evaporation. We'll spray water on them and then have like a fan. So you're getting the evaporation, and then with the fan, you're getting convection. So think convection oven, right? So it's blowing air. So if you have like cold air blowing over you, that's going to cool you down. Another one that's big, especially when we're talking about backboards, like cold big pieces of plastic, and we're trying to keep our trauma patients warm, we put them on a cold piece of plastic, they're going to lose heat through conduction. So just touching something that is cooler than you are is going to cool you down. Does that make sense? Another one is respiration. So as we breathe, that's also how we maintain our body temperature as well. So if you're hyperventilating, that can actually take your temperature down just a little bit, which is interesting. So conduction, direct contact, water, chill, convection, air, water, carry away heat, radiation, heat is picked up, and then evaporation and respiration. Any questions about this stuff? What?
I thought he was pooping in a hole. So I was like conducting.
Steven's always got something to say like that. It's funny. He's pooping. Whenever there's a test question, I want you guys to remember poopy guy.
Yeah.
That's what I thought it was first.
You lose heat by pooping? In multiple ways. Your butt cheeks touching the toilet is conduction.
It is. That is true.
Does that mean that you pooping is evaporation?
Yes.
Possibly, if you get
Or
sweaty.
radiating.
Yeah, you could radiate.
Okay, I'm done, sorry.
Next slide.
Next one. All right, so exposure to cold reduces body heat. Obviously, if we've all been there, we stand outside and you start shivering, you're like, oh, I'm cold. So if our body cannot maintain a core temperature, then it starts causing emergencies, right? So old folks and kiddos are very susceptible to this. So kids have a larger surface area of skin to body, so they're just susceptible to environmental things anyway. And then old folks, they just stop losing their ability to compensate for everything across the board. That's why whenever you go into Mima and Papa's house, it's like 96 degrees in there in the middle of summer, and they're like, oh, it's a little chilly. My mother is that way. Her house is always like 85. It's ridiculous.
Gross.
Yeah. So if they're in shock, no matter what kind of shock, that if their body's worried about trying to keep them alive from like leaking out, they're gonna get cold anyway, right? So we already learned that in trauma, we lose heat. So that's what we're trying to do is we're trying to keep them warm during trauma, but their body also doesn't hang on to that heat as well as it normally. Any kind of injuries, infection, or immobility can cause problems to maintaining core temperature. Hypoglycemia, so remember cool and clammy, your body's already getting cooler if it is hypoglycemic. So that can cause like a problem with them maintaining. And then we already talked about the intoxication. You kind of lose your normal feelers whenever you're drinking. And so even drugs. So that's another predisposing factor that can make it. So talk about this. So their body systems slow down anyway. And so we've had patients, or I've seen patients, also like older populations, if they're unable to afford like their electric bill, like it is not abnormal for them to be living in houses that are freezing in the middle of winter because they can't afford to keep it warm. So then, in turn, they're susceptible to getting hypothermic. Mima that fell at 2 a.m. is laying on a cold bathroom floor all night until somebody comes to check on her and finds her, also hypothermic. So even if her house is warm, if she's laying on a cold bathroom floor, she can get hypothermia from that as well. So those are all things that you want to think about whenever you're dealing with like the older people. So again, kids, large surface area in comparison to their body size, so they're susceptible as well. And then they also don't have as many muscles. Kids, so them being able to shiver, that's how we keep ourselves warm, is by shivering. They don't have the muscle mass. So wrap the kids up when it's cold outside. All right, so assessment, shivering in early stages, right? Numbness, reduced or lost sense of touch. We've all been cold in here. We all know what it feels like. You can't feel your fingers anymore. Stiff or rigid posture, drowsiness. Once you start to get sleepy and you're cold, that's a bad sign. Like they're starting to get sleepy, their brain's like, good night. So it initially starts out with rapid breathing and pulse. Their body's trying to compensate, and then they can no longer compensate, so everything slows down. Loss of motor coordination, decreased level of consciousness. So it starts out with red skin. You know how your nose gets all flushed out and your cheeks whenever it's like really cold outside. Once it starts to get too cold, they'll get pale or cyanotic. They'll look blue. I always picture the guy in The Shining when he's like frozen dead. That's them. And there's probably a picture of him somewhere in here. I would be surprised if there's not. So what part of our body is most susceptible to cold?
Skin.
Nose, fingers, which has skin. Oh, what's that?
It's the right answer. You just have to
Fingers.
describe.
Yeah, fingers, toes, nose. So anything that's exposed, ears, the tips of ears. So whenever we start looking at like frost nip, frostbite, all that, usually the fingers are the first thing you go to, the tip of the nose or the ears.
I didn't know not to put my hands under hot water,
Ouch.
and oh my god, and it
Oh,
felt
it hurts so
I
bad.
literally
Yeah.
felt like someone put my hands in like fire.
Yeah.
I was like, ah.
This hurts me.
I was like, but I'm cold. It don't make
But I
sense.
felt diesel on my hands when I was in the army. Canned slip, we got like -15 in Yakima, Washington. And I got diesel on my hands. They actually flew me to Allegan Army Hospital.
Yeah.
My hands were starting trembling.
So to warm them up, we're going to passively rewarm. So by passively, It's not like putting hot packs directly on the skin. So when we're talking about passive, that's what we're talking about. So the active part of rewarming is the hot packs. Make sure they're not touching the skin directly. You want to make sure those things can burn you too. So you want to make sure that you keep them covered up with like a towel or a pillowcase or a sheet or something. Don't put them directly on the skin. Put it in the core. So if you're trying to rewarm somebody, put it, see how the picture has it, like neck, armpits, groin. You want to start warming up the core first. And so from there, everything will circulate out to the extremities. Remove wet clothing. So get a naked. If their clothing is wet, they're going to stay cold. So just take it off. And then whenever we wrap them, a lot of times we have that like foil wrap where it like radiates their own heat or whatever heat they're trying to produce back onto them. That's really important. Now, whenever we're trying to warm somebody up, where this differs from like treating for hyperthermia if they're too hot, whenever they're really cold, warming them up is a slow process. So you can cause a lot of damage. They'll start to shiver. You can have a lot of problems if you warm them up too quickly. Your hands hurt real bad. Think of that like in their whole body.
Never
right?
did it again. Sucked.
Yeah, so if they are able to tolerate liquids, give them warm liquids, have them sip it. If they're not able to, obviously if they're unconscious, don't be like that meme where it's like, yeah, little baby, like the little ducky. Anyone seen that?
Hey, go.
Yeah. It's like, here you go, and it's like pouring out of their mouth. Don't do that. So if they are unconscious, be mindful that they might not have discernible vital signs. So with the metabolism slowing down, everything kind of mimics, like it goes really slow and it feels like there's nothing there at all. They'll be cold to the touch. Always put your hand on their core. See what their core, because my fingers can be cold, but my core is warm. So if they're pulseless, start CPR with an AED. So obviously if they're like frozen, don't start CPR, right? That's obviously dead. But if they're cold, maybe they just got pulled out of a river. So what's the word I'm looking for? Obvious signs of death is if they were submerged for greater than 6 hours. So if it's less than 6 hours and they still seem viable, you still want to start CPR. If you are unsure if you feel a pulse, make sure you're starting CPR. So don't be like, I might feel it, I don't know. Remember, that's a 10-second check. If you're not sure, just start CPR with the AED. So if they are altered in any way, unresponsive, altered mental status, you're gonna start warming them. Check their airway, their breathing, their circulation, do all the things, treat the symptoms, right? And this is a big thing that's gonna get drilled in your head. They're not dead until they are warm and dead. So if you have a hypothermic patient that you started CPR on, that's not one of those that you start and you end in the field. If we start CPR on somebody that is cold, we are taking them to the hospital. They will not call it until they have a livable core temp. So just be mindful of that. Again, if they're frozen stiff, it's okay. Just let them go. All right, so nose, toes, ears. That's the big one. So anything that's not towards your core starts far away and then kind of moves its way up. So what's the difference between which one of these is frost nip?
The ear.
The ear. It's like this white waxy. How are you gonna fix that?
Passive warming.
Passive warming. Am I gonna say someone has frost nip on their fingers? Am I gonna take their hands and rub them?
No.
No. Why?
Because it's gonna hurt like a mother.
It's gonna hurt. You can cause damage to that tissue as well. So we want to slowly warm these patients up.
Deglove them too if it's too bad. Like kind of rough.
It could, yeah. If that tissue is like dead enough, you're gonna freaking get off. So early superficial frost nip, it's like a waxy white, remove from the cold and cover up. Slowly warm it up. So, and then your late deep frostbite, start talking about like discoloration that's not white.
Dude, his nails are falling off.
Yeah, his little fingies, they're like, see ya. There's, from my understanding, there's no recovering from this, like those are gone. So, you're gonna give them oxygen, you're gonna cover affected part and handle gently. Sometimes they recommend like splinting it, how you find it, so you're not like moving them around too much, causing more damage. So, yeah.
But if you splint, well, I guess you can not use tape. Never mind.
Yeah.
They, like, if you splint it, sometimes they use the tape, especially for like the fingers. But if you use the tape, it'll peel off the skin.
Yeah.
And but there's other ways you can splint it. So
Right.
never mind.
Yeah, like maybe like a Sam splint and then just like wrapping it or something. That's a good point to make. Don't put tape on it. All right, so active rapid rewarming is not usually recommended unless your local protocols say to rewarm it. If the doctor on the phone says, warm them up fast, you're gonna say, so you want me to warm them up fast? And they say, yep, okay, now you do it. It's okay to question doctors on the phone. That's not abnormal.
Or in person.
Or in person, yeah. If your transport is gonna be severely delayed and you can't call medical direction, I still wouldn't even rapidly rewarm them, slowly start warming them. So towel warmers are fantastic for this kind of thing. I've had patients before where like their feet had frost nip and we just took like the warming blankets from the hospital and just wrapped his feet up. And so it like slowly warmed it up. It wasn't like a hot pack directly to it, but it was just warm enough to slowly rewarm. That was perfect. Warm water, not hot water, because hot water hurts. And then if you just dip them in there without, if it's like a smaller container, don't shove their hand into like a little tiny cup. Make sure that they have enough room to like move their fingers around. So the other thing, if you're trying to rewarm somebody, if they're past the point of shivering, as you start to rewarm them, they'll start shivering again. And so a lot of times we'll actually give like Versed or some kind of benzo. So ALS can be recommended for that as well, because we don't want them shivering because it can cause a lot of like other problems with their like metabolism and stuff. So shivering is not always good. There you go. Everyone stays elevated. I don't usually carry a trash bag like this. I mean, we have trash bins, but not one that a foot will fit in by any means, unless it's like a kid's foot. Our little trash bins are like this big. All right, so exposure to heat, hyperthermia, right? So hyper being high, thermia being the temperature. So it can lead to death. So we've all heard of heat stroke, heat exhaustion. So we'll talk about the differences between them.
Can I preface this by saying fires are, there is about this many calls that you are gonna run that require ALS. Very few calls really require a paramedic. Exposure to fire is one of those calls. Because once their airway slows up, they're done. So this is like in that small handful of things that you really, really need a paramedic quickly.
Please.
This is gonna kill somebody. Really fast.
Please, for the love of God, call us before their airway swells so I don't have to do the crike because it's scary. I'll do the crike, but it's still scary. Put on somebody's neck. All right, so heat exhaustion versus heat stroke. So heat exhaustion, they're still at a functional level. That heat stroke, as soon as they get that altered mental status, it's now heat stroke. That's where we differentiate the two. So heat exhaustion, faint or dizzy, they'll still be sweating. A lot of times they'll say heat stroke has no sweating. That's kind of going out of favor as being able, that's how they used to recognize the difference between the two. That's not a thing anymore. So we're not really doing the no sweating thing. But just know if they're not sweating and they're like hot as shit and altered, that's gonna be your heat stroke. So nausea, vomiting, you're gonna have for both. That's something that's present. Whether they're able to keep food down or hydration down is a big play in your guys' treatment. Because if you're doing a standby for like a marathon or something like that, a lot of times your protocols are you'll have them try to drink something or eat something like electrolytes. And if they vomit it up, now that's an ALS call. They need, or ILS, they need IV fluids. But if they can, you can cool them down with drinking Gatorade and that kind of stuff, and they keep it down, that's a good treatment for that. I'm just gonna throw in that paper. So their pulse, this is rapid weak pulse and it changes to a strong pulse. I'm guessing that it changes because you start to get like brain injury. So your pulse will start to go stronger. And then muscle cramps is a big one in heat exhaustion. And then the loss of altered mental status is your heat stroke, like the big differentiation. Big words are hard.
But can't they still pass out from heat exhaustion?
They can, yeah, but usually it's like a pass out. But once they're staying altered, that's a heat stroke. So like if you're like working outside and you pass out and wake up and you're like, dang, it's hot out here, there's your heat exhaustion. But once I get there and you're like completely out of it, no longer able to recognize things, that kind of stuff, that's your heat stroke. But yes, heat exhaustion still can make you pass out for sure. All right, so heat cramps, if you think about it, kind of like levels, heat cramps is the first level. So moist, pale, normal, cool skin, you start to get cramps, right? We've all gotten those cramps running outside or playing outside or lifting things outside or working outside. You start to get heat cramps. That is the best time to treat this, right? Obviously, you want to treat it early. So if you're starting to get heat cramps, the best thing you can do is go inside or go into the shade, drink some water, drink some electrolytes, hang out, cool yourself down. Salt loss is a big one, so you'll see pickle juice, mustard packets, Gatorade, that kind of stuff. You're trying to replace that salt. And so muscle cramps, weakness or exhaustion, weak pulse, heavy perspiration. What's perspiration?
Sweating.
And then your loss of consciousness. So heat cramps, heat exhaustion.
I should have that.
So cramps is just the cramping, exhaustion is where you start to get all the other stuff. All right, so take them out of the heat, read their ABCs, cool them down. If they are able to tolerate small sips, encourage that. And then moist towels over cramped muscles. Honestly, I've tried to like actually put cold packs on like muscles like that. Just give them the electrolytes. That's what's going to fix their cramp. So you can try and make them a little bit more comfortable, but the electrolytes is the big one.
Can't you take clothes off too for the cooling down part?
Yeah, you can. You can take the clothes off, put like water on them, and then a fan. That's a really good way to cool them off. Or you could just like soak whatever shirt they're wearing. If you have like a water bottle and just soak the shirt that they're wearing, that'll start to cool them down too. One of the worst like heat stroke calls that I've had was a lady. She was on one of those little electric scooters. It was like hot as crap outside, and she was like driving a little electric scooter around her backyard, and it died. And she had no way of calling anybody, had no way of getting out of her scooter. So she just sat there and freaking roasted in the sun for like hours. All right, so heat stroke. Their temperature mechanisms fail. So this is where they say that you stop sweating. Again, don't just say, well, they're still sweating, so it's not heat stroke. Don't ever think that. So, if it's non-exertional, think of your older people, like that lady that was in the electric wheelchair, that's a non-exertional thing. She's just sitting out, baking in the sun. And then like your marathon runners, anybody that's outside working, that's your exertional. If they do stop sweating, they can't lose that heat anymore. So they just keep getting hotter and hotter and hotter. So our sweating is our body's way to keep us cool. So if you're not able to do that anymore, you're gonna have a bad day. So altered mental status. That's how you know this is no longer heat exhaustion, this is a heat stroke. So any kind of altered mental status, whether they're fully unconscious or if they're just altered. Rapid pulse, weakness, little or no perspiration, dilated pupils, and then potential seizures. So the problem is like your brain's dying from the hot temperature, but then also you've lost a lot of salt. So if you have hyponatremia is what that's called, that can cause seizures as well. And so it's kind of like a mixture of both things. If you ever get a scenario where it's like hot and they're on a lobster boat or some weird thing like that, always assume heat stroke until proven otherwise. You still want to check other things off your list, like your glucose, you want to check their oxygen levels, all that stuff, but you treat for heat stroke. It might be in the next slide actually, but what's our treatment for heat stroke?
Take them out of the environment.
Yep.
Passive rewarming.
So you're going to do active cooling.
Active cooling.
If they are to the point that they are altered from being hyperthermic, there's a lot of agencies that carry body bags on our ambulances for this reason. They'll take body bags and fill them with ice and water and cool them down on scene. So if you are on a call and you have access to something cold, like a pool or ice chest or something, you need to start that process now. This is not something like we'll cool them down on our way to the hospital. You need to get them cool immediately. So if you can get them cool in the back of your ambulance, that's great. But again, there's a lot of agencies that carry body bags for that reason, because they're great with filling up with cold water and then just dunking the patient in there. So
who's on a fire department here? You guys carry fire shelters at all?
Oh, yeah.
Use those. And if you guys have ice chests on your engines, those are always hot. You put them in that fire shelter and you just dump whatever you have in the ice chest on them.
it seems weird because we're like, this is one of those calls that you would take longer on scene just to cool them down. So even though you're like, they need a hospital now, they need to get cold now. And if you can do that now, let's do it. So, yeah, thank you. I could just imagine like your ice chest is full of Gatorade and ice, and you dunk it, you take like a Gatorade bottle in the head or something. Like, oh, no, he's got a head injury. But that's a great thing, yeah, because the fire department here carries that ice chest with their stuff in it. Yeah. We should talk to Mikey about carrying body bags for that. Maybe not today.
Yeah.
Okay. Maybe that one. All right, so you can remove the patient's clothing. Sometimes you'll see that, like, you'll see videos of treatment for it, and they'll just pour water on their clothing too, so that's an option. Cold packs to the neck, groin, and armpits, just like the hot packs to the neck, groin, and armpits. Cold packs. For kids, you don't want to cool them down way too quickly. The reason for that is a lot of the same mechanisms behind like a febrile seizure. The fever, like the high temperature, isn't what gives a kid a seizure. It's the rapid change from hot to cold or cold to hot that gives them the seizure. So same kind of theory here, because they're a little easier to cool down because of how much surface area that they have on their little tiny bodies in comparison to their body mass. Pulling them down quicker can cause that seizure. You don't want that rapid change of temperature. So slowly do it for the little kid. Treat the symptoms. Airway, they're not breathing, treat that. Their heart's not beating, treat that. And then if they're not breathing well, give oxygen. Already said that. Okay, that's what we're talking about. That body bag, they are watertight. So that's the great thing about them, is that you can dump the patient in there. If you have, what's the most accurate temperature to get on a patient? Like where? Yeah, where? Up the butt. So core temperatures. So if you have access to a like thermometer probe that's rectal, that's going to be your most ideal temperature that you get. I have yet to work on an ambulance that actually has like rectal thermometers. So in the mouth is your next best bet.
Does it actually have to be a rectal thermometer, or is that because I think thermometer just tests the temperature?
Yeah.
Well, you know the difference between them.
One's for your butt, one's for your mouth. I don't know.
The taste.
Ew. I will never, ever put a thermometer.
Oh, yeah, so if you actually go into the ER, the rectal temperature or the rectal thermometers are red.
They have a little red thing on the top. So if freaking Sylvia walks in there and you're in the ER one day with the red one, yuck.
You know.
Just
Yeah.
no.
You're like,
Go grab the other one.
Yeah, go grab the other one. Okay, so cold water immersion is considered the gold standard for rapid cooling in cases of exertional heat stroke. Provides faster cooling rates compared to evaporative or convective cooling methods. So this is a big deal. It's really coming into fruition. They started talking about it about 5 years ago, these body bag things, and now you're just seeing it more and more. So it's a good thing to have. If you don't have it, it's a good thing to bring up. Or something like it, like the fire shelters. Okay. So, as the temp decreases, our muscles start to shiver. Another thing about being cold is at a certain temperature, I believe it's 88 degrees core temp, our heart is very, very prone to dysrhythmias. So those dysrhythmias that we talk about shocking, like VFib, once your heart's at a certain temperature and it's that cold and you're moving the patient around, just you moving the patient around can send them into like ventricular fibrillation. So that's something to consider. Don't be like jostling them, right? So, or have your AED ready to go. Your central nervous system starts to slow down. Everything gets slow with the cold, right? We're like lizards. You know, lizards get cold and they like slow way down. We're basically lizards. So as our body temperature increases, we sweat, obviously, so we can cool ourselves down. That sweat is evaporated off of our bodies, and then as that excess heat builds up, everything becomes too hot. So like they'll be hot to the touch. And your brain starts to fry. I think it's like 104, like a temp of 100. I can't remember the timing. It's like a certain amount of brain cells start to die with each temperature 1 degree rise. I can't remember what. It's significant though. Your brain cells are like.
And when you do the active like cooling process, also monitor their temp. I think they recommend pulling them from that like cooling process at like right around 100 to 101, because it's kind of like freaking meat, right? Like when you smoke meat, you pull it out, you know, before it gets to temp because it's gonna fill up. Their body does the same thing. If you're actively cooling them, once it gets to a certain temp, you have to pull them out because their body's still going to cool down some, and you don't want to make them hypothermic by leaving them in that bath. Right? Keep that in mind.
I just breathe. All right, so water-related emergencies. Big one's airway obstruction, obviously cardiac arrest, signs of a heart attack, injuries to head and neck, as people like to dive into pools, internal injuries, if they are like whitewater rafting or something and they get tossed off the boat, now they're the raft and they're knocking on all these rocks and stuff. So water makes you cold, so hypothermia is another thing. Think substance abuse whenever you have a drowning. Also, individuals that are like severe autism, severe development,
Say that to me.
having is developmentally delayed, they are drawn to water. They will go jump in a body of water. So autism is a big one. If you are ever on like a BOLO, like be on the lookout for this autistic kid that ran away, the first places that they search are bodies of water. So statistically, they just like to go jump in it. So, and then drowning. So there's drowning and there's near drowning. There's a difference. So near drowning is like you were up under the water, you started having like that coughing fit, you didn't die. Drowning is death. So you can have where you drowned and then came back to life, that's still a drowning, but near drowning is like your heart didn't stop. So there's a difference between the two. Yeah. Okay, so respiratory impairment from submersion or immersion in a liquid, and then that person struggles to keep afloat. But just keep in mind, if anybody in here has ever been like a lifeguard or something, that drowning is not a big splashy event. It's like they're there, they have trouble, and they slowly go down. You're not going to see big splashes. Drowning is a quiet thing that happens, so it's very dangerous. So when they start to submerge, our instinct as we drown is we try to take one more deep breath. So what can happen is our larynx, our little vocal cords, spasm. They close shut because our body's like, well, we don't want that water getting into our lungs. So that's a big deal whenever we're dealing with near drowning or drowning patients. Whenever you first go to give your BBM breaths, it's going to be really hard because of that laryngospasm. Their airway is shut off. And so one way, does anybody remember how to get rid of that laryngospasm? We talked about it. Big breaths, yeah, big breaths. So like forceful, 2 good forceful ventilations. A lot of times we'll relax it. Another thing that we can do, and you'll be doing it if you're doing a jaw thrust, is we have this pressure point that's right here. And as you go to lift someone's jaw, if you push in right where their TMJ is, there's a pressure point that will release a laryngospasm as well. So those are things that we want to be mindful of, because you can be doing CPR, right, and trying to bag, and you're getting like these measly little breaths, and you're like, I can't get their chest rise. Do good breaths, and then from there you'll see.
Oh yeah, I felt it. Like if you push hard enough, you can feel it down.
Yeah, if you like push, you can feel it. Right in here. And it hurts. So then, if that laryngospasm relaxes, that water can enter the airway. They cough, and then that leads them into swallowing more water and inhaling water. So that's another thing with drowning patients or near drowning is their lungs start to fill with water. So as you're trying to manage the airway of a drowning patient, it is a nightmare. So they'll have a lot of like that frothy stuff start to come back up. You'll get like a lot of froth in their airway. So right now they're recommending that if you're doing airway management on a drowning or near drowning patient, that you actually want to shove that water back in with like positive pressure, your BBM, because the stuff that allows our lungs to slide easily and us to breathe well is called surfactant. And so they're noticing, or what they realized, is that water comes down and it'll actually take that surfactant out with it. So all that bubbly stuff that's coming out is not just water, it's surfactant as well. So you're trying to keep that in the lungs. So the positive pressure ventilation, CPAP, if they're with it and they're like coughing, a bunch of bubbly stuff up, same kind of thing as your like flash pulmonary edema. You want to keep it in the lungs. I know it sounds ass backwards because you're like, get the water out. But you just want to shove it further down with positive pressure. Does that make sense? Okay.
The body absorbs it.
Mm-hmm.
Yeah, so it's like the same
Breathe it
concept as like the congestive heart failure patients, right? So like so it'll go down to the little raviolis and it'll redistribute to those capillaries down there and then shoot out into your body. Now later on, they're gonna have a fluid overload issue and they're gonna end up probably needing like some Lasix or some sort of diuretic to get some of that fluid off of them. Maybe their body just absorbs it and they pee it all out and like it's fine. But yeah, it's the same concept as the congestive heart failure patient. It just goes down there and just distributes back out.
Does it matter if it's salt water versus fresh water?
Yeah.
That's
So-
a really high concentration of salt.
Yeah, so that's the other thing with salt water, is salt water will pull fluid, right? So that's another big one. They're more susceptible to certain kinds of like infections and stuff when it's like salt water versus fresh water. And then you have to think about that osmosis that happens with really salty water too. So it can actually pull that surfactant. Those are the ones that are like really susceptible to like that surfactant getting out, coughing up. If that makes sense. So yes, there is a difference.
But keep it in anyway, and then they'll just have to diuretic shit ton of water.
Yeah, if they even need that, right? So like our bodies are capable of metabolizing things too. So if they need it, it could be, but I'd rather deal with having to diurese somebody later and then be alive than not alive. So. Okay, so some who die have that lack of air. Unconsciousness results from hypoxia, because obviously we are not fishies. So if we're under the water, this is what those vocal cords look like. So this is your normal view. This is what we're looking at whenever we're intubating somebody. And then this is that laryngospasm. So they start to come together and you stay shut. And so you're having a hard time. That's their airway. So you want to get that relaxed as you try to get back down. So. All right. Who in here has heard of dry drown? There was a big thing on, I think it was like Facebook 10 years ago. Where they're like, my kid choked on some water and then they died a week later from dry drowning. So, you've heard of that? Yeah.
Within a couple of hours or a couple of days or something?
Yeah. Yeah.
Is it also from like secondary drowning?
It's called secondary drowning too, I believe. Yeah, or they'll call it dry drowning. So what it is, drowning is you're submerged in water, you're hypoxic from being submerged in water. Dry drowning is like a result of the problems that happen later. It's not something that I've had a lot of parents like, my kid's face went under the water and came back up, and I think they might dry drown now. If there's no significant event of like coughing and hacking after that face went up under the water, the instances of it like dry drowning happening is super, super low. So this is like a near drowning, basically. So they're getting that water in their lungs. It was like a big scare because they put out like, my kid died hours later or weeks later or whatever it was. And then everybody whose child faces touched water, they were like, dry drowning. So it can still happen. Like you get like this infection in your lungs, you get a shift of fluid from that water entering the lungs. But kids just don't go under and come back up and be like, and have dry drowning. There's always a significant event. Like they were pulled out of the water, they were hacking, they were trying to cough up like water, they puked multiple times. Like it's never just like your face touched water and now you dry drown. That's not a thing. So. Also, hours, not weeks later. So if they need to get checked out, they need to get checked out quickly. You get a call for somebody whose kid's face went under the water 2 weeks ago. This isn't something that's going to happen within weeks. It's hours. Okay, so there's that frothy stuff. Drowning airways are tough to manage anyway. You're trying to deal with the frothy, you're trying to deal with any possible puke. Because if they were like gulping water as they were going down and it overextended, it's gonna come back out. And then you bagging them anyway is just gonna possibly hyperextend their stomach. So be mindful that drowning airways are they are a nightmare. If you can't get them out of the water all the way until somebody else gets there, you can still try to give those rescue breaths while they're still kind of submerged in the water. Ventilate more forcefully, we talked about that. And transport fast. What's a big thing we want to do in any kind of near drowning or drowning patients? oxygen, lung sounds is another one. So one of my first calls as a paramedic was a 12-year-old drowning at a hotel. And I got there and he was up talking like fine. But they said he was down up under the water for a while. Someone noticed, pulled him out. He coughed, like he had a bad little coughing fit. When I got him in the back, it sounded like crackles in his lungs. So he was talking to me. His oxygen was a little low, it was like 92, it wasn't bad, but he had fluid in his lungs. So that was something that we needed to take care of, obviously. So that's where that like CPAP comes in. But unfortunately in Atlanta, they didn't let you put kids on CPAP. So do what you can with the protocols that you're given. Spinal injuries. Every spinal injury patient or question that you have, I'm not going to say everyone, but you're going to get they jumped in the pool head first, now they're acting weird or they're unconscious. It's a spinal injury. If you see that on an NREMT test, like think spinal injury. Head dive in a pool, spinal injury. They should live together.
Is it always going to be a compression injury too?
Not always, because sometimes you'll have like that hyperextension of the neck. So just not every time. But yeah, you could definitely like crunch it down. Because you have where like you dive in, but your head like snaps back. So resuscitation should be started. This is an ALS call. If somebody's spinal cord is injured and they're hypotensive because none of their vessels are talking to their brain and you get that dilation, like our test question that we just had, they need medicine to get their blood pressure up. That's not like a lay them flat, give them some fluids kind of thing. That's like a start an F strip kind of thing. Have you guys seen the video of the guy? I think he's holding a spatula or something, and he steps and he starts like falling, and his friend just watches him fall, and he like I'm just gonna have to find it and show you. He like crunches in half, like he falls between the boat and the dock, so his legs come up and his butt's like in the water, and then he like slowly goes in the water. That's what I always think of when I see this video. I'll find it. I'll show it to you. Oh, sorry.
Yeah.
Water is scary, okay? All right, so scuba diving accidents. We don't really deal with a lot of that out here, unfortunately. So the big thing about scuba diving is the bends. You might get a question about the bends. Arterial gas embolism. So a lot of these are caused from whenever you like dive and then come up too fast. You have like a pressurized, our body's like pressurized, right? But as that water pressure is pushing down you and you come out of it too quickly, you can get little gas bubbles that go into your bloodstream. Sometimes they like to settle in joints. That's usually where you'll see those symptoms first, like elbows, wrists, knees. And then from there, they need a hyperbaric chamber. So if you have the bends, is what they call it, they need treatment in a hyperbaric facility. Another thing to keep in mind if you're dealing with a scuba diving accident is they cannot go on like an airplane for the next like 24 to 48 hours. So because they were so far down here, they're slowly supposed to come up and say that they got the bends. You're not supposed to put them in an airplane for like the next couple of days. So arterial gas embolism, that air is forced into their veins, vessels, arteries, and that air bubble comes, and if it hits your heart, that's a bad thing. So a lot of times they recommend just keeping the patient on their left side so that air bubble can hang out in the top of the right atria and try not to move out. But it's purely dependent on your protocols. So that gas bubble, depending on where it goes or how many gas bubbles they have, is going to be like dependent on where the symptoms are. So altered mental status, loss of consciousness, blurred vision, seizure, stroke, respiratory or cardiac problems. So if it's like in the heart or in the lungs, that could be a problem. Incontinence, if they have chest pain, myocardial infarctions, stroke-like symptoms, just purely depend on where that air bubble goes. So think of that air bubble like a clot. Like if you have a clot in your brain, what symptoms you're gonna have. Same thing with these air bubbles.
So we only have one decompression chamber in this region. It is not an emergency decompression chamber in Elko. But it's at a private practice facility. I have heard that they can use it if necessary, but the next closest is obviously like, they're not being up there by like Tahoe and stuff like that. But just keep that in mind too, that we don't have one readily available this region.
So if something happens around here, you just drive them then?
Yep.
You can't fly them, right?
Well, so it depends on the altitude that they'll be flying at. Because I've heard it would be one of those like I'd call and ask, because I've heard sometimes that like the elevation change that they're getting put on a helicopter to go short distances is not the same if they're going further distances. So I would call and ask.
Yeah, because like,
If you're ever questioning it, just drive them.
yeah, the helicopters can fly at such a low altitude to the road. There's a chance they can fly them and just follow the highway all the way down there, just a couple hundred feet off the highway. But yeah, you have to chat with them, see how the days look.
All right, so this is that bend that we're talking about. So decompression sickness, that diver went down, they dove down deep, they came up too fast. So whenever they come up, they have to come up at increments, so they don't get decompression sickness. It can take, it doesn't always appear right away. So a lot of times this is like your joint pain. So altered mental status, it gets really bad, fatigue. Sometimes I was listening to a podcast that was talking about it, somebody that had the bends, and he said he got done diving and he just like felt like a twinge in his little elbow. And he was like, oh crap, this is actually decompression sickness, because he was a paramedic. So he was able to recognize it quickly. But a lot of times it's not recognized that quickly unless they really know, like are very well experienced in diving. Modeling of the skin, if there's any kind of signs of low perfusion to a singular limb, that could also be a sign of your bends. Respiratory problems, again, if it's going into that lungs. And then what's peripheral edema?
Swelling of the extremity.
Good, yeah, swelling of the extremities. So those are things that to take into account. I mean, if you're in an area where people dive a lot, I guess Tahoe people dive. So that could always be a thing. Someone told me, so when I was working in Atlanta, my paramedic class, we had one of the guys that worked at the Atlanta Aquarium come in and talk to us about all this stuff. And he said that this kind of stuff can actually happen in something as small as like the Atlanta, I say as small as the Atlanta Aquarium, but it was huge. It's because of the gas that they use that causes it. So it's not always like really, really deep dives that can cause these problems. It can be shallower, more shallow dives as well. So keep that in mind. According to all of our aquariums that we have out here. You're in the Battle Mountain pool, scuba diving. All right, same thing as everything else. Treat the symptoms, oxygen administration, keep the patient warm. So that this is where they're saying position them on the side. That's what they're talking about, that air embolus. The theory is air likes to rise. So if you put them on their left side, that air bubble allegedly hangs out in the right atria and doesn't get shot out into the rest of the bloodstream. That's their theory. I just gotta take a right here. Now my eyes are watering. It's any questions about this stuff? Okay, marine life. This, the stingray tails, RIP, but I've also, the guy that came and talked to us, he said this is one of the most excruciatingly painful things that he's ever dealt with. So I guess they'll break off and hang out in the bottom of aquariums, so people go out there and like do a little dive and accidentally get stuck by one. There's like a vinegar compound that they put on it, but they said like hot compresses are the key to like maintaining like comfortability through this. Like it's just painful all around. But as you see, the way that they're serrated is they're meant to go in and not out. So if they do come out, they're causing extra damage.
So keep them in.
Huh?
So keep them in.
Yeah, I wouldn't remove one by any means. Yeah. But if they fold it out or something, it's still gonna be painful either way. There's little toxins on there. That shit apparently hurts really, really bad. And then salt water, warm compresses.
Pee on.
Don't pee on it.
For jellyfish.
I'll tell you what else really sucks, freaking saltwater catfish. Bastards poke you, freaking hurts. And you get real swollen. No, careful for them
They have
bastards.
pokies.
Yeah, they're freaking gills, they're side gills. They have freaking barbs on the end of bastards, and I've been cut on the hand, my freaking hand swole up. Like they have some sort of toxin in there to like ward off predators or whatever. And the bastards will freaking, it hurt real good. So be careful for the little bastards.
So just the saltwater ones or freshwater ones have pokies?
I mean, the freshwater ones have pokies, but they like just kind of like poke you and you're like, ouchie. Like the saltwater ones have that like toxin in their little barbs, and then bastards are like, ouch. You know what I mean?
I've never been from that. I cannot relate.
Yeah. That's why you grab catfish under their gills. You freaking go up under their little gills and hold them up like that when you grab them. Because if you try to go over them and lay them down, they flop around, they freaking. So you need.
Come to Chaz with all your catfish questions.
Did you doodle?
He's a connoisseur.
Did you do doodle?
Frick no. We have these things in the south called snapping turtle. Bastards, but they're about this big around. They got heads on them that are freaking this big around.
And they bite really fast.
Yeah, they're not
Really
slow.
fast.
about it.
No.
Have you ever watched one of those things snap something?
Oh, yeah, it breaks it right in half.
Yeah, it's crazy.
Yeah, go ahead, stick your finger in that hole you want. We also have these things called water moccasins.
Oh,
Oh man, I'm Caucasian, but I'm not that Caucasian.
Other ways poisoning can happen, eating it, obviously. What's that one thing that you get from oysters?
Deliciousness.
Yuck.
A full tum
I can't remember what it's called. It's basically like you just shit your brains out for the next like 3 to 5 business days.
Food poison?
It's called something else. No,
Possums?
I mean, maybe, but it's called something else. I'll think of it. So yeah, it can cause a lot of problems. Oysters. And then apparently, allegedly, they say like people that have had this disease, they're like, those were the best oysters I ate in my whole life. Vibriosis. What is it?
Vibriosis.
Yes, that's it. Vibriosis.
Norovirus.
You
We-
won't-
we did
won't
the same
catch
thing,
me
we both
freaking
Googled it.
oysters. I don't like them.
I tried one time. And
Hey,
I was
yeah.
They're disgusting.
my buddy like put it in a shot glass and put like the best one. He's like, here, just shoot it. And so I was like, he put his hand on my mouth. He goes, boom. Look at me.
Somebody
Look
told
at
me
me.
yours was chewy.
Horrible. It tastes like.
Okay, who's seen this in any lake? Usually there's signs posted, reach, throw, row, go.
Yeah, it's so funny, the different regions, because everybody in Georgia's like, yeah, man, we've seen this before. Everybody out here like, no, no.
Yeah. I grew up in Battle Mountain. So
There ain't no water out here.
trying to get someone that's drowning. There are water rescues if you live someplace with water. So there will be water rescues. If you are not trained, do not jump in the water to save a drowning person. Here's the thing about somebody that's drowning is they're
Oh, they will drown, take you down with you.
yes, they will. Yes, they will. Dogs will do it too. They get punched in the face. Yeah, so I'm pretty sure, was it you that was telling me about to save them? Like you literally choke them out.
Yeah,
So they just go
Yeah.
limp and then you're like, all right, let me save you.
That's what they taught me in water rescue.
Really?
Just choke them out.
Yeah. Go sleep, go sleep. And then they're like,
Saying you'd be good at water.
ice rescue, so protect yourself, don't walk out onto the ice. Again, reach, row, throw, go. So reach for them first, throw something. If you can row out there, if it's like thin ice, and then actually go out there, unless you're trained. Don't be jumping in ice water. So our body's response to ice water, who's gotten like something cold dumped on them?
It's
What's your initial reaction? You take this deep breath in, right? So that same thing applies to ice cold water. So your body is like, oh crap, and like your brain just stops like functioning for a second. But if you're submerged, your initial reaction up under the water is to go as well. So what's the problem with that?
Suck in the
Suck in
water.
water.
Suck in the water, yeah, that's a bad thing.
Suck in that water.
So treat them for hypothermia. Be mindful of any airway issues that could be because of that. And transport. High altitude emergencies. So you will see this abbreviated as like HAPE. It's high altitude pulmonary edema, and then PACE. So high altitude cerebral edema. So we'll talk about these. So up here we ain't got no oxygens. Ain't got no oxygen up here. So less air to breathe, less oxygen, decreased air pressure, and then they have to adjust. So who in here has watched a documentary of like climbing Mount Everest and they have to go hang out at the base camp, right? So hang out at the base camp, they get it acclimated, then they go hang out at the next camp, they get acclimated. They have to hang out in the town before they even go to the first base camp, so their bodies can acclimate to the high temperature or high altitude, high temperatures, low temperatures, high altitude. So you have to get adjusted, and then if you're not adjusted, it can cause other problems, right? So acute mountain sickness, they might just have like a general feeling of unwell. It's not quite like breathing problems. It's not quite like brain problems yet. It's just like a general, I feel like shit, my body's not used to this. And so this is like your acute mountain sickness. And then that can obviously progress into something more severe. So.
I have a question.
Yes.
Since they don't typically recover bodies from Mount Everest, does that mean Mount Everest is technically getting
Yes.
Yes. And you know they like poop up there.
Yeah.
And so like it's really getting bigger now, and then all their trash that they throw everywhere. Yeah.
Well, they do actually have, like, at least for the trash, they do have missions where Sherpas go and take the trash down.
Sherpas. I grew up on a Sherpa.
The only reason I know about that is because I watched a 4-hour documentary of a kid named Ryan, and that was like the whole point of his Everest climb was to raise money to get trash out.
Yeah.
Yeah.
Well, if you see pictures of the base camps, they completely wreck them.
Mhm.
There's so much trash everywhere. So I mean, you might as well raise money for it. All right. So in severe cases, your fix is getting them out of that altitude as quickly as possible. So. Oxygen, you can give them oxygen, but immediate descent is the big one. So here's that HACE that we were talking about. So high altitude cerebral edema. What's cerebral edema?
Swelling of the brain.
Swelling of the brain. Very good. So think head problems, so headache that worsens over time, balance and coordination because your brain's affected. Your brain does all of that for you. Severe fatigue. In really bad cases, seizure, altered mental status, loss of consciousness. So get them out of the high places into the low places.
But if somebody went down in high places, do you have to acclimate to get up there?
I mean,
But it depends, right? So like, if, you have somebody that's used to hiking, like like a tourist, like Ruby, right? Like somebody that's used to hiking in the Ruby Mountains, get some person at freaking Georgia that lives at 50 feet above sea level. Like, oh, I want to go freaking hike up to the Ruby Mountains. And they pop in freaking Elko in their little plane, they jump up in there, freaking hike, and you run into this, right? Because their body's not acclimated to that. And then, like, because it can happen in the movies. And then you get, you know, the local responders that are used to that. Typically, they don't really have to worry about it as much because they're not going up.
I know with the Rubies, they have specific teams that will actually go up there. They won't have
Yeah.
like the first responders going up there.
Like
They
even
have
on,
specific teams that they go up and down and they ski and do all that other fun stuff up there all the time, so.
like is even like on most ski resorts, they have teams.
Yeah.
Like on snowmobiles that
Right.
deal with high altitude sickness.
Yeah.
All
So
this
they'll
other
have
stuff.
like the groups of people, same thing, right? Like it's the middle of the summer, they'll have like a team go up there and grab them. But typically, like these people are training in that environment, so like their bodies are used to it. That's the reason why these freaking Sherpas and Everest can go up there and hop up and down that mountain all the time, because their bodies are so used to doing it. So.
Like they live there, that's their normal.
Aren't we like 5,000 feet in elevation here?
Yeah, it sucks. I came here from Alaska and couldn't breathe.
Seattle. So when I would drive here, I would get like, I feel like shit and couldn't breathe for the first 3-4 days.
Yeah.
And then I go home and I'd be like, oh, I can breathe.
Yeah, that's the same thing with us, right? Like, we went up to Alaska back in September, and we did this hike, and it was like 4,000 feet of elevation gain in like 4 miles, right? We were up there freaking
Yeah.
cooking, bro. Like,
You
we
were like climbing rocks.
we were like, yeah, frick yeah, because we were like in Austin, we're used to hiking up in the Ruby.
Yeah, we started at elevation like 500 or 450.
No, it wasn't even that. It was like 150 feet of, it was like 150 feet at the base, and then we went up to like 4,000 feet, and we were freaking like.
You got someone's oxygen.
Yeah.
The climb down sucked though, like
Oh god, it's so
blistered on the toes. Chaz looked like a freaking.
Go ahead.
You look like a lobster.
He looked like a baby cow trying to walk for the first time.
I was like, freaking take one step.
It's like a roll my ankle, I rolled my ankle.
And then like the next like week, I was walking up steps like freaking sideways. But I wasn't out of breath, so that was nice.
Our muscles melted for sure. Well, whenever we first moved here, we were only here for a few months and we went up to Great Basin National Park. And we were like, let's just go hike. And we couldn't like eat a granola bar and hike at the same time. We were like, I can't breathe.
Yeah, and we weren't even like hiking a bad hike. It was just kind of like a little
Yeah.
thing. And I was like walking and I was like eating a granola bar and I got like 2 bites in and I was like, I gotta stop. She's like, you're okay? I was like, I want to eat.
Yeah, so you gotta be acclimated, basically. Start taking it. So pulmonary edema can also happen at high altitudes. Again, treatment, get them out, right? So get them to a lower altitude. Shortness of breath, if they start coughing up frothy stuff, that's a bad day. Coughing up blood, that's a bad day. So usually if it's coming from the lungs, it's gonna be frothy. What's tachypnea? Rapid breathing, good. So PNEA is breathing. Tachycardia, a mild fever can happen, hypoxia. You can have HAPE and HACE at the same time. So don't look for one over the other. They can both be in conjunction. So chest tightness, arrange for immediate descent, oxygen, try not to have them move around a lot. So if they're like somewhere, try not to get them to hike down unless that's all you can do. And then provide supportive treatment.
So it's not like with water where you have to slowly rise. You can get them out as quick as possible.
Yes.
without having to-
Uh-huh, yep. Because the big thing with water is the pressure differences, because the water is putting pressure on you rather than, okay, you know, oxygen, air.
So like if you've ever like dove into a pool, that's the reason why whenever you get to like a certain level, you feel like that pressure in the side of your head, like your ears. Because whenever you're free diving, you're supposed to like continuously pop your ears as you're going down. They teach you how to like equalize. So as you're like when I was snorkeling in Hawaii, you go down to a certain level and you have to sit there and equalize. So you pop your ears, and then you can go down a little bit further and pop your ears. But that's where it comes. It's just so much pressure. Yeah.
Yeah, so don't worry about like a slow descent for that kind of thing. You want to just go as quickly as possible to the lower. Okay, bites and stings. So look at that cute little baby. So cute.
They're super cool until they jump on you.
They're not gonna hurt
I
you.
always go up, I'm like, trying to put it on my finger, and it's like, yeah!
I know that this is about bites and stings, but I want to teach you guys my fun facts about jumping spiders. So first of all, they wear water droplets as hats. That's cute as shit. You can't even. So their legs, how they jump, is not like their muscles. What they do is they have a little tiny muscle in their belly, and it shoves fluid into their legs, so it's like a hydraulic system, and that's how they're able to jump so good. Isn't that fun?
That is cool.
That's a fun fact. They also have to calculate their jumps. So like if a singular little fly flies by them while they're trying to jump, it'll throw them off kilter and they'll miss what they're jumping for because that's enough like force to get them. So that's fine.
We have a jumping spider within our freaking plant cabinet.
I saw him yesterday.
I have a few there's one that lives in my shower and like he'll die and a new one replaces him. And they eat whatever unwanted bugs I have.
As long as you don't jump on me, we're cool.
Every
They do their little dance.
They eat the earwigs and then shower.
Yeah, they're good. They're nice. Okay, now we're off of my little autism train. So certain animals and plants, obviously we know that they can produce toxins that are harmful to humans. We talked about the Jimson weed thing the other day. Now that I can remember what it is, so I'm trying to remember it. It wasn't coming to me last time. So all spiders are venomous, but a lot of times they can't like break our skin. So that's, don't go munching on a spider. And then they are rarely like super dangerous unless you're allergic to them. That's like the big thing. This guy's got a bite on his arm right now. Keep scratching on
Bite from your jumping spider.
it. It might be
I'm talking that shit.
Black widows?
Black widows
Yes.
actually dangerous.
Oh,
Yes, ma'am.
I'm
Yeah.
not sure of shit from my house.
Yeah, so the black widows, what they do is that their toxins create a lot of muscle problems for us. So like usually your textbook question is gonna be like, you're presented to a male on a wood pile that started experiencing the worst stomach cramps of his life. You should think black widow spider. So it causes, like it's a toxin to our muscles, and so it can actually cause a lot of problems. Fun fact, the treatment for it is calcium chloride is the treatment. All right, so difference between poisonous and venomous. So poisonous, if you bite it, you're dead.
Yeah, you're not supposed to bite the bag.
Venomous, if it bites you, you're dead.
Ingested versus injected.
Yes.
It's a very psychopathic way to bite from. Just back.
I know.
Just eat the head.
No.
Man, I'm hungry.
Bullfrog.
Bite the leg.
I whole lick the frog thing.
Well, yeah, like the liquid toad thing.
Yeah, I watched a documentary on that. It's deserts and orange toad. You actually just like squirt the red ones on you and dry it. And then it's just breathing.
They're all over Georgia.
It's illegal to own one in Nevada.
Oh, really?
Nevada, Chad.
So toxic organisms, we have our brown recluse spiders. We got those around here, I'm pretty sure. Yes, I know they were in Georgia too. So if anyone's ever seen a recluse bite, they are absolutely horrible. Horrible.
Yeah.
They like eat away at your skin. Like you end up with these ginormous like blister looking things that'll bust open. Yucky. So black widow, that's another one, very toxic. Again, its toxins are really bad. Like it causes a lot of muscle problems for humans. And so, and abdominal cramping, abdominal pain, bad day. There was a case where I think it was a lady, she crushed up a black widow spider and injected it into her veins.
Ew.
And I'm pretty sure she lived, actually. I'll have to pull it up, I'm pretty sure. She's a lucky lady. Yeah.
Why would she do that?
Spider-Man.
Yep.
Yeah,
Oh,
Spider-Woman.
well, yeah, psych problems.
Someone
are-
bring it for you.
Yeah.
And then this scorpion in particular is very toxic. Again, I don't know if these ones are around here. I know we have scorpions, but I don't know if this guy lives around here.
Isn't it typically the smaller they are, the more dangerous they are as well?
I've heard that too,
I
like,
don't know if it's true though.
I know with like snakes, like less mature snakes, if they are venomous and you get like a baby rattlesnake,
Rattlesnake?
a rattlesnake, who's hungry? Yeah. Hey, I eat the roadkill. The rattlesnakes, the younger ones are more dangerous because they don't have like the mechanism to, like, control it. They're words. I told y'all, I warned you before the class that you'd have to help me.
Right away.
Yeah, they just hard inject you. They whatever's in their system, they're just gonna inject you with, like the older they get, they like control the injections. And
I think
like the
that
little
might
ones
too.
don't.
That's at some point, get rattlesnake dry bite too, but not injection.
Yeah.
They'll do that
And
just to
some of
scare
them don't
you.
have rattles
The baby
anymore.
one.
A baby can't do that.
I heard there, some of them out there don't have rattles. So you can't really tell.
Rattlesnakes?
Yeah, they're starting to.
Hybrid.
Yeah,
Hybrid them.
because it's an evolutionary trait, so they don't get killed.
So anyway, I started blasting.
Yeah, that's terrifying. I
Head
did not
to
know
go.
that.
Where are
Um,
these at?
Here.
I don't know where they are, but there was a study that they did.
So I will tell you, that rattlesnake venom, the antidote for it is like 10 grand a vial. We don't care. They've actually, so they won't give you that vial until you become severely symptomatic. Like you gotta get pretty sick before they give it to you. And Winnemucca has it,
They have one vial, right?
yeah, and Reno has it,
Elko, doesn't Elko have one?
and Elko has one. So if you get bit, good luck, bro.
Google the symptoms.
Yeah, best of luck to you. All right, so insect bite or sting. I'm pretty sure everybody in here has been bit by some kind of bug before.
Mosquitoes.
This is what it
Anaphylaxis.
looks like.
Sorry, scratching it. Yeah.
Where's the circle? You didn't draw a circle around.
I actually really did.
Really?
I did
Yeah,
the other
go
day.
for it.
This is
Hell
like
yeah.
2 days old now. But you should have seen it the first day. It was like huge and red and swollen, and I was like, circle.
Put an X in it.
Put an X, yeah.
Make an X with your fingernail.
Yeah, to try to freaking drain it. I've done every goddamn thing in here.
It helps stop
Try
the
to
itching
freaking-
too. Yeah, if you
Yeah.
push
You know what
hard,
else
if you
helps?
love press and hold
Have you ever
your
seen the
finger,
weave pat?
What?
Sure.
Where I like, freaking they get the weave.
Okay.
It's called a weave pat.
Yeah, whenever certain individuals get weaves.
They get weave put in their hair.
That's how they scratch them. They call it weave. Yeah, it works great for tattoos too, actually. Okay, so yeah, find the symptoms. There you go. Redness, swelling, or blistering. Most of the time, they're not deadly, but could be still. All right, so treat for shock, assess for anaphylaxis. What defines anaphylactic shock?
2 symptoms of 2 fucking
or
things
systems.
affected, or just your breathing.
Okay,
Airway.
Airway or two or more systems.
good.
Smell what I
You
was
got
putting
there,
down.
it just went this way.
The 2 things are I don't like those little fucking things.
Bees,
No.
He
The
gave me
wheels?
answer, I just put it in.
Well, no, it's the wasp one. That's not.
yeah, wasps suck because they just continue to bite you.
Oh, I got 8 up in Tahoe one time.
Freaking pow, pow.
Oh, dude, it was fucking horrible.
Wasps or hornets, which one's the really aggressive that'll just be like, fuck, I
Wasps.
don't like you because you exist?
Blind both. Hornets and wasps are both aggressive.
You know it's gonna be.
So I had one of them just chilling like with his little baby hive on my trampoline the other day, and it let me work like 6 inches away from it, and it didn't do anything. It was just chilling.
Until you least expect it. And then it's
Yeah.
like, ah!
Yeah, it's already player murder. So,
I don't like those things.
like, all right, Tuesday night, 9:00.
Right, when you least expect it.
At 1 p.m.
How do we, remove a stinger?
With the
Wait,
credit
credit
card.
card.
Credit card,
Cha-ching.
flat side of the knife. Remove the jewelry from the affected limb. If it's like super swollen, you might have to cut off the jewelry. Try not to do that though.
That was just.
Like the back side, like not the sharp. I mean, you can probably do the sharp side if you're careful.
But you just drag it out?
Yeah, just drag it out. Why don't we squeeze it?
Doesn't have
Squeeze
squeeze
in more venom.
Yeah, you'll squeeze in more venom. Like if you use tweezers and you go to squeeze it, it'll put more stuff in there and you don't want it. So if you're treating for anaphylaxis, make sure you remove the stinger because you're not really helping yourself out if that stinger's still in there. So get that thing out there. Snaky snakes. Usually not life-threatening, can be though, so keep the patient calm and at rest. Don't keep the limb above, what is it? Keep the limb, they used to teach, like keep the arm above the heart or something.
Yeah,
I don't know.
you can try the whole like sucking it out thing. Yeah.
Don't you have like a leaf earring to do that in olive oil?
What?
You never watch Snakes on a Plane where the lady uses her leaf earring to cut the kid's arm? And then she puts like olive oil in her
I've
mouth or
never
something?
seen snakes on a plane, but it sounds like I might
What?
get you after today.
You've never seen.
I've never seen
You gotta watch it. I'm tired of playing buckets.
I've never seen it. Yeah, so pressure mobilization bandage, try and keep their limbs. I was taught, actually, you know what I was taught? I was taught to keep their limbs below their heart. And I was also taught to splint, so you don't want their arm to stay like bent, so you try and splint their arm like straight, because it'll that venom will congregate into their joints, is what I was taught. They don't really teach that anymore, so.
You missed the perfect opportunity to use that. I'm a snake.
I'm a snake. I should have.
I caught my first snake yesterday, maybe the day before.
I was here.
No, for the water fire training. It was like this long, little kind of skinny noodle. It looked like I thought it was a worm for a minute there.
Really?
It was real tiny. It was long.
Yeah.
You'll kill the fella.
We got a snake that's coming to us as soon as we figure out what we're gonna live.
I couldn't see.
Okay, so rattlesnake, they got rattlers, or they used to. Apparently they don't anymore. That's kind of terrifying. Copperheads, they look like little Hershey's Kisses on the side to me, right here. These are like, I don't think we have them around here. That's like a south snake. I was always warned, like if you smell cucumbers while you're hiking, it's a copperhead.
So
Yeah, Billy
One-
can't smell anything. So.
Billy's a friend. The one thing you can look at too, so the coral snakes don't really.
Sorry.
The coral snakes don't really do it, but so the venomous snakes will have like a more compact head and be like more like triangle. Yeah. So they're like more forward. Yeah. So they got that more like diamond triangle.
Spades.
Yeah. So just keep an eye on that. The non-venomous snake have like that rounder. Only like real, yes, contradictory snake to that is these coral snakes because they all put muscle. You just gotta watch for that color. You don't really have to worry about that right now.
No, but I did hear that the bull snakes are just as toxic because of all the toxins that are in their mouth.
So they say that. Same thing like rat snakes. You'll hear that a lot of times. That rat snakes will like make you sick because they have like crap from rodents in their mouth. I've been bitten by rat snakes before. I've never been sick. Take that for what you will. I'm not saying that it couldn't happen, but yeah, they do the same thing with like freaking rat snakes. These little bastards right here are dickheads. I don't know if you've ever dealt with water moccasins, seen water moccasins.
I've only seen them on TV when Shelby goes around and catches them suckers at night.
Yeah, well, Shelby's a ding ding. These bastards are one of the most territorial snakes that you'll ever run into. If you are ever in like a creek bed, I don't really know that they're around here, but any sort of creek bed, riverbed, anything like that, if you see one of these bastards, do not go anywhere near it because they are territorial and they will chase you. They don't wait for you to get close to them. They will get close to you if you go to dicking around with them.
They're like, they see you from a distance, they're like,
They're more down
Yeah, they're like, in particular, frick that guy. And they lay beds and like creek beds and stuff, and so you'll see them down in like Georgia, where they'll freaking pop their head up, and you'll see like 6 of them, like sitting there with their freaking head pops up in the creek. No, that is a big no-brainer.
What's the saying? It's like if.
Red on black in front of Jack.
Fellow, red on black.
Red on yellow, kill a fellow.
Red on yellow, fellow, fellow, red on black, fellow, black.
Listen, if I see that thing coming toward me, I'm not gonna be like. Right? I'll be like, I'm gonna get the frick out of here. Yeah.
I've just keep things out.
Yeah, they always
Like,
take, I'll mess with
typically
the
venomous animals, no poisonous animals from like.
You just get a big old kiss.
The, I think if I'm not
I've had
mistaken,
that
the
happen
king and the
before.
coral,
Right
the
here.
coral is really bright. Queen looks.
Oh, really?
Same colors, like different.
Like
borders.
vibrancies?
Yeah,
Okay.
even in that picture, I don't know if it's just every picture I've seen is like that, but, interesting.
All right, so, snake bite treatments. So if you can get like a picture of the snake with you, that'd be great. I'm not carrying around I'm not gonna be like, let's go hunt down this rattlesnake.
Right, here you go, Becca. Rattlesnake.
She's gonna be like, yeah, whatever. And I like cute, cuddly snakes, like, what's that, the ball pythons and stuff. They're cute, they're cuddly. We can be friends. Rattlesnakes, they.
They're just sexy.
So here's all your signs and
They're not
symptoms.
sizing you up. Yeah, huh? He said they're just trying to size them up. The biggest guy in the room's like, oh, they're just trying to size you up. What's trying to size him up? Anaconda?
A reticulated
Anaconda,
python?
like, oh, I'm not gonna freak this dude. It's like freaking 12 foot long. Yeah, buddy. It's freaking ball python, 4 foot long. What's he gonna do? Bite your knee?
I'll stop it.
Yeah. That's what got me in my gym was a boa constrictor. Freaking popped me in the gym right here to the desk here. He freaking popped up and I was like, frick, wham! And I was like, oh, you little dick.
So they still recommend to mobilize bent extremities, whether you want to mobilize them straight out or bent. I was taught straight out so that poison doesn't stay in their joints. But okay, draw a line. What did you? You were way ahead. Line. So draw a line. Check for redness. Check for swelling. Don't do a tourniquet on that extremity.
Oh, it's so cute.
Look at how cute that is.
Is the thing about the pupils true, you know? That there's slits versus like that? Like if the pupil on snakes, is that how it was always how they're gonna smell?
I mean, if you get close up there, people figure it out. I don't
No.
think you're gonna have
I don't
to-
want to snake that close. I'll be like, let me see that. Let's see your eyeballs.
It's nice. Ow, wow, ow.
Yeah, the only snake I haven't been
Yeah.
till this day is bull
And it was like,
snake.
Yeah, I've been bad. It's all right, man. It don't hurt that bad.
It stings just a bit.
I got a full car, I'm sorry.
I was like, rattle.
Oh, gosh.
It's true.
What?
It is true. Look at that. She just looked it up. Venomous, yeah.
How the hell are you gonna get that close to see if it's venomous?
He's like, hey.
Yeah.
It's like taking a finger, sticking on it.
You ever watch Harry Potter? You see that weird voice that he does.
Or with those cobras that sit there?
Oh, was that there just playing a flute, slapping him on the head?
Freaking, have you seen the video of the dude that's like cleaning the cage of the freaking cobras and the freaking cobras like, oh man, he's like, wham! He just slaps the piss out of him. I'm like,
I watched a video like that.
Me?
The guy who was running with the flathead shovel, thing up there, and they see him come and they run, and then they didn't keep Dinko on the top of the head, and then they go into the water. I don't know what it was about it, it fucking killed the guy, laughed forever. And they got
They act so nonchalant about it, but maybe that shit,
Yeah,
it's like,
It's normal.
It's just really,
It's fucking normal for them. Yeah.
I don't remember what the first guy.
Get out of line.
I think I said some of the, oh yeah, the catfish, I have a photo. Like this.
Yeah, them freaking little side, yeah. I'm telling you, bro, them freaking side. So with catfish, they have, when you look at their little side fins, they have a bone that runs down the outside of their side fin. And that's what freaking gets you. At the end of that bastard, you're freaking sharp. So you take them off their belly and you run your hands up them. And so you hold them to keep their fins up. Because I've grabbed them and tried to like lay their fins down, and the things are kind of strong, and they freaking, I lay them down and I go to grab them, and they freaking do this and freaking cut their hand.
it's kind of like the bass, but they don't have the venom in them. Like if you don't hold a bass right, they'll do the same thing. Like
Oh,
you try
that's
to
their
hold-
gill plate, yeah.
Yeah.
that's your project.
It's like if you try to hold those, they're the same way. They're
I like catfish.
Yeah, we catch catfish down in kind of Georgia, you catch.
And he's going up, he's like.
You catch 10 or 20 pound catfish.
There's another one, that's crazy.
Look at that. What is that? Crossbow fishing or whatever?
Oh, yeah, bow fishing, bow fishing. Yeah, you don't use a crossbow, you use a regular, like, compound style bow, and it's got a, like, almost like a fly reel on it. So, freaking pop it, and a lot of people do it with gar, because gar are kind of pain in the butt to catch. The best way that I found to catch, like, gar, is you take, like, something shiny, like a little flashy, metal, like fishing lure, and you tie it to a nylon rope, and you take a nylon rope and you get a brush and you brush it out so it flares it all out, you get something nice and poofy. And so they'll attack the shiny, but when they attack, they grab it and roll real fast. Those alligator gar will grab it and roll, and they get all the teeth wrapped up in that nylon rope. Because if you fish for gar and you try to hook them, now you gotta try to get that goddamn hook out of your mouth. And that's they will freak you up. And so gar were, some of the rivers down there, they were like invasive
So by the time
species, so
you
like
get
when they
to
get one out of the river,
it
you
probably
freaking
already.
cut the line and just shove them there and kill
Already
those.
past the point.
Pretty fun catch. But you go down to the dam or the river down there, and fish off the bottom of that dam, you catch big catfish out of it, and those are fine, like, you don't freaking, you just grab them or kill them, hold them. And, like gar and stuff, I mean, they had freaking gar, as long as that table down there, freaking swimming around that river. You know, catch gar, straight bass.
Yeah, like you want to sell a big fish tank.
Oh, yeah.
Out for free. I'm trying to catch a bass for the duck hunt.
Thank you. Yeah.
It's a dream, okay, that was the
Nobody's shooting your dream now. It's all good.
He's sticker kid.
These stickers and everything, it don't matter. We don't have any yet, so I know. I'll
Oh,
show you a picture of this baby.
hold on.
Listen, I was gonna say, I'll bring you coffee if you bring your snake and let me cuddle it.
Listen, if I get my snake before the end of class, I'll bring it.
We're just having some housing
Oh,
issues,
so that
so
last
we're gonna work through before we get it. Couple of things before I freaking forget. Thursday, they told us last minute that they're having a hospital board meeting. So, just so that, how long is the PowerPoint on Thursday? Because it's 8, right? Are we doing 8 on Thursday? Is that y'all's next homework assignment?
No,
Sure.
Trevor. So this Thursday.
OB's this Thursday? Yuck, how long is that PowerPoint?
Too long, pretty long.
Okay, so,
So why is there a picture of a snake in the ocean?
Oh.
59.
Longer than the one tonight.
okay, so we don't delay y'all. What we're gonna do is split everybody off So people will be in the kitchen, in the computer room, like so bring your laptops and everything, try to bring them charged so that you don't need to keep it plugged in while you take your test. Here at 5, we'll do kind of the same little deal. Everybody will just break off and take their test. Supposedly the hospital board meeting's supposed to be over like right around 5. So after everybody's done taking their test, we'll bring all of our crap in here, we'll move into here.
Should we come in through that side door?
Yeah, come over here to this door instead of this door, because they'll be having a hospital board meeting unless you just want to come in here and freaking get weird stares when you walk in the door. So don't go in that door, go in this door. The volunteer thing for the disaster day thing on Friday, I got the email about that.
Mark.
So, let me find this email.
How old is this?
All right, so the volunteers need to arrive at 6:30 at the Health Science Building, room 107.
Gross.
I will be here doing right
She's
along
like,
that day.
probably like 40.
So, Health Science Building, room 107. They'll get you all set up. Freaking with whatever they're gonna do. Me and Becca will be there. There's a chance y'all might not see us. I know they want me and Becca, one of us, to coordinate helping one of the nursing homes, because they're gonna be involved in it and taking patients. So they want one of us to like teach them triage methods and like how to do all that. So one of us is gonna be doing that. One of us is gonna be proctoring people out in the field. I don't know how all this is gonna disperse, where everybody's gonna be. So, that.
Well,
Why do you talk to you?
where was this gonna be at? In Elko?
In Elko.
And was Ally supposed to be helping? And she's not now? You have a spot, like, do you need help still?
I mean, they'll take help, yeah.
Oh, I can't get there late then. I don't get off work till 6 in Valley, so then it would be late, like, what, 2 hours? Probably don't.
I can reach out to Jamie and have you an answer by Friday. If it's something that you want to do. Like I said, I mean, it's just completely optional. It's a cool experience. You get to go out there. So the big thing here is like, depending on where your spot is, act as realistic as you can, play your injuries out, respond to responders like you would, or like you would expect somebody to respond. Don't be like over dramatic about it. Don't under dramatize things, like, find a good happy medium there. Yeah, so Health and Science Building, room 107. Me and Becca will be there at some point. Bring some sunscreen, or jacket, I don't know, whatever the temperature is supposed to be that day.
It's Nevada, wait 5 minutes to
66,
change.
but at 6:30 in the morning, it's not gonna be free.
Yeah, pretty cool.
So my problem is I'm on shift.
Yeah, I'm gonna talk to Ursula and have her come in early.
I'm gonna sleep in.
No,
We show up late.
no, you fully need to come. If I'm going, you're going. Yeah. Feel like there was something else, but I don't remember. If I remember later, I'll just text it to everybody.
Do you know how long it
Are you gonna
lasts?
create a new?
2 hours.
For kids?
So I will say the same thing that I said when the last
I
people
remember.
asked. If individuals do no longer want to participate in the group, they are more than welcome to remove themselves and leave the situation. So I'm not about to go in there and try to re-enter everybody's freaking phone numbers and freaking all that.
I don't even have half the people's names saved.
I don't have any of your names.
Yeah, so.
I don't even know who texts half the time. The only reason why I know is because like his name pops up, but freaking Tina's pops up as Andrew. Like,
It must be like a Samsung and like Apple thing, because like your name pops up on my phone.
yeah, his name pops up on mine too. So
Yeah, I
some
have-
people's names popped up. If your name don't pop up, I don't know.
Mine's in Northern California.
I don't know what that
It's only
means.
5 for you.
So, all right. I think that's it.
Yeah.
Any questions? I
Thanks,
remember,
guys.
Thursday, I'll either be late or not here.
that is a her problem. Not a me problem. I will not be here. I will be working on an ambulance in 1 month.
No way, you volunteered or not
Thank you,
volunteered?
Adam.
I'll either be late Thursday or.
We have a lot of money
here.
with.
Friday.
I'm not here, I am.
So I can make up.
How long you been doing this? Text me.
Did y'all get y'all's email yet?
So.
You work